What are jowls? How do they form, and how do we correct them? Hi, I'm board certified facial plastic surgeon, Dr. Delaney, and let's take a deep dive into the anatomy of jowls so we better understand them. You can see right here, this is the jowls. The jowls, technically speaking, is loose subcutaneous tissue in its overlying skin. It's not extra fat like a lot of times people will think. So liposuctioning this area actually won't really help. So you can get jowls here where you get fullness, and basically you have tissue hanging over the jaw border. And then sometimes if you get more fullness a little bit higher up in this area, that's actually the buccal fat herniating through. But jowling is here, and you can see the loose skin does not pass this area by the mouth, and I'll show you why. I have several incredible figures from Dr. Brian Mendelssohn's amazing study on the anatomy of the area. So first off, let's look at the muscular attachments of this area. So we have three muscles on the inside of where we typically see the jowls, where these muscles attach to the jaw. So you have the platysma, depressor anguli oris, depressor labii oris, and so these are the depressors of the lower lip. Importantly, these muscles not only attach to the mandible, but they also attach to the skin, the dermis, to allow for activity on the lower lip so you can pull it down. So they help create what's called the labial mental sulcus out here, or the marionette line, which a lot of people commonly refer to. So this is very similar to the concept of the upper lip muscles attaching to the nasolabial folds, which I had mentioned before. And so similarly, these muscles attach to create this crease, and then everything out lateral to it is not attached to bones, more loose. Over time they'll stretch and hang over those areas. A lot of times people mistakenly think a deepening metalabial sulcus or marionette line is an issue of volume loss, where in fact is actually tissue laxity hanging over those areas. But because these are areas of adhesion, as tissue hangs over it, it looks deeper and deeper, but it's really not volume loss in that area. Why do humans have jowls and other animals maybe don't have it? And this is a very interesting study on evolutionary change in human beings over time. So our mouths over time have become smaller and smaller, and then also we're developing more complicated lip movement. We have wider musculature that allows us to not only have facial expression to communicate, but actually to have complex lip movements to speak. So this has allowed our face to kind of change over time, and it has become more sophisticated. And then so as a result, because our mouth is smaller, we need more gliding in order so we can open our mouth without our upper face being pulled down. Otherwise it would be like this. So you can see the area where we need to glide our soft tissue in human, for instance, is a lot more compared to canine, for instance, where they don't have these important lip depressor musculature. They don't need to worry about gliding. They simply need to just worry about opening the mouth as big as possible so they can eat. So much less amount of gliding necessary compared to human beings. So what does that gliding look like? So here's a comparative illustration with the mouth in a closed position and the mouth in the open position. So when the mouth is closed, obviously nothing is under tension, so everything is nice and relaxed. In order to allow for this glide function, the skin in this area has longer connections to allow for the opening and closing without pulling on the upper face. So at rest, you can see all these connections are going upwards. They're connected to those muscles that we saw just earlier in the first illustration. So what happens then when you open the mouth and you have this wide glide zone, these long connections then go up, and this allows us to open up the mouth and the jaw, and without any tethering on the upper face. So what happens is we have this glide zone that allows us to open and close our mouth. When we're younger, all the connections are a lot more elastic. We have better collagen, so they spring back. But what happens over time is, as you know, in the skin, we lose elastin, we lose collagen, so that springiness diminishes over time, and then so rather than springing back to where it was, now gradually you get more and more overhang. So how do we treat this? This is, again, like the nasolabial fold, the jowl is a matter of tissue laxity. So adding volume, while there is concurrent volume loss happening in the face, adding volume is not the primary treatment. The primary treatment, again, is some kind of a lifting procedure to resuspend the tissue. So the jowls is also not an issue of having too much volume. Liposuctioning the jowls is not going to be helpful. So again, some kind of a lift procedure is the ideal and best way to treat it, whether a targeted treatment of the jowls or a targeted treatment of the jowls and the mid-face. That is the best and preferred way to treat jowls.